Hello, my name is Dr. Diwan S. Raja. Today I will demonstrate the anatomy of the heart. Heart is a hollow muscular organ that is located in the middle mediastinum of the thorax. Heart has four chambers. This is the left ventricle. This is right ventricle. This is right atrium. This is left atrium. Heart has an apex. This is the apex of the heart, formed by the left ventricle. It is located in the left fifth intercostal space, medial to the mid-clavicular line. Heart has base. This is the base of the heart, formed by the left atrium and partly by the right atrium. Base is related to the thoracic vertebra 5, 6, 7, 8 in standing posture. It is related to the thoracic vertebra 6, 7, 8, 9 in lying posture or supine posture. Okay. Heart has sternocostal surface or anterior surface. It is covered by the sternum and the rib. So this is the sternocostal surface. It has the posterior surface that forms the base of the heart. The left lateral surface we also call it left border. The right lateral surface or right border of the heart. Superior border is indistinct. On the sternocostal surface, we have the anterior interventricular groove. On the diaphragmatic surface or inferior surface, we have the posterior interventricular groove. This is the posterior interventricular groove. That is here is the posterior interventricular groove. Okay. So we have sternocostal surface, posterior surface. We have the inferior surface that is also called the diaphragmatic surface, because heart is resting on the central tendon of the diaphragm by the inferior surface. On the sternocostal surface, we have the pulmonary trunk that carries deoxygenated blood from the right ventricle, and pulmonary trunk is divided into left pulmonary artery and right pulmonary artery. Left pulmonary artery is going to the left lung, carrying the deoxygenated blood. Right pulmonary artery is going to the right lung, carrying the deoxygenated blood to the right lung. From the right lung, oxygenated blood is returning to the left atrium through the right superior pulmonary vein and right inferior pulmonary vein. From the left lung, oxygenated blood is returning to the left atrium through the left superior pulmonary vein and left inferior pulmonary vein. The pulmonary trunk is connected to the arch of the aorta during intrauterine life. At the bifurcation, at the proximal part of the left pulmonary artery, there is a communication near the bifurcation between the arch of the aorta and the most proximal part of the left pulmonary artery near the bifurcation. The communication is called ductus arteriosus. After birth, it becomes ligamentum or fibrous. We call it the ligamentum arteriosum. Okay. Then we'll go to the aorta. This is the ascending aorta, arch of the aorta, descending thoracic aorta. The ascending aorta ascends from the left ventricle. Ascending aorta has two branches. One is the left coronary artery, another is the right coronary artery. The left coronary artery has two major branches. One is the LAD or anterior interventricular artery and the circumflex artery. The LAD may have the lateral diagonal branch, and the circumflex artery may give rise to the left marginal artery. It may also give rise to the ventricular branches. The LAD in the anterior interventricular group, the group between the left ventricle and right ventricle, we have the anterior interventricular group, and it contains the LAD or anterior interventricular artery, branch of left coronary artery, the great cardiac vein, a tributary of the coronary sinus. These are present in the anterior interventricular group up to the inferior border of the heart, close to the apex of the heart. This is the anterior interventricular group. Okay. So these arteries may communicate with the arteries in the posterior interventricular group here, in the posterior interventricular group here. Okay, so this anterior interventricular artery may communicate with that of the posterior interventricular artery near the inferior border, close to the apex. The right ventricle has the pulmonary trunk. It has two divisions. Left ventricle has the ascending aorta that continued as the arch of the aorta. Arch of the aorta has three branches: the brachiocephalic trunk, left common carotid artery, left subclavian artery. The brachiocephalic trunk or brachiocephalic artery has two branches. One is the right common carotid artery, another is the right subclavian artery. Okay, we got that. Now we will find out the right atrium. Right atrium receives the superior vena cava, inferior vena cava. This is the inferior vena cava, and the coronary sinus. So three vein opens into the right atrium. This is the right auricle. This is eel-like extension of the right atrium. Embryologically, this is the primitive atrium. Like that, this is the left atrium. This is the left auricle. Auricle are eel-like process. They come above and anteriorly. Okay. Then we have just discussed superior vena cava formed by the union of the left brachiocephalic vein and the right brachiocephalic vein. Superior vena cava formed at the level of the right first costal cartilage by the union of the left brachiocephalic vein, right brachiocephalic vein. Left brachiocephalic vein is oblique. It is longer. Right brachiocephalic vein is shorter and wider. And superior vena cava has no valve inside it. Okay. So we got the ascending aorta, left coronary artery, two branches, circumflex artery, and the LAD or anterior interventricular artery. Accompanying vein in the anterior interventricular group is the great cardiac vein. From the right coronary artery, it goes downwards and to the right side. And it gives rise to the right marginal artery. Okay, it is not distinct in this model. And it goes posteriorly and it gives rise to the posterior interventricular artery in the posterior interventricular group. Posterior interventricular group, we have another vein. We call it middle cardiac vein. That is the tributary of the coronary sinus. Okay. So we got the left coronary artery, right coronary artery. Look at that. Left coronary artery. This is left coronary artery. Left coronary artery supplies the left ventricle, interventricular septum, and part of the right ventricle. Left coronary artery also supplies the wall of the left auricle. Okay, left margin of the heart by means of the circumflex artery. Right coronary artery supplies the right atrium, right auricle, right ventricle, maybe a part of the left ventricle. Okay, so we got the left coronary artery, right coronary artery. Right coronary artery also supplies the conducting system of the heart. Also, the conducting system of the heart also supplied by the left coronary artery. In the wall of the heart, we have other important vein like the coronary sinus. It has multiple tributaries. One is the middle cardiac vein accompanying the posterior interventricular artery, small cardiac vein, and the right marginal vein may be a continuation of the small cardiac vein, or right marginal vein may open into the right atrium directly. We may have other vein on the right ventricle, they open into the right atrium directly. If the right marginal vein is not connected to the small cardiac vein, then small cardiac vein is really small. It may not go up to this level. It may end up here. Okay, we got that. So we got the coronary sinus, its tributaries, small cardiac vein, middle cardiac vein, the great cardiac vein, okay, the great cardiac vein, and we may have the left marginal vein is a tributary of the great cardiac vein. From the coronary sinus, we also get the left posterior ventricular vein, and we may get oblique vein of the left atrium as a tributary of the coronary sinus. So that's all about the external surface of the heart. Again, try apex, base, the left auricle, right auricle, superior vena cava, brachiocephalic vein, left, right, brachiocephalic trunk or artery, left common carotid artery, left subclavian artery, descending thoracic aorta. Okay, we have the pulmonary trunk, left pulmonary artery, and the right pulmonary artery. We have pulmonary veins, right superior pulmonary vein, right inferior pulmonary vein. Left superior pulmonary vein, left inferior pulmonary vein. This is the left pulmonary artery. Now we'll go inside the heart. Okay, let's start. Let's open the left ventricle. Okay, wall is very thick. Outside we have the epicardium, that is the visceral layer of serous pericardium, and this is the visceral layer of serous pericardium lined by simple squamous epithelium. We call it mesothelium. Muscle is the myocardium. We know the histology of the cardiac muscle. There's cylindrical muscles, centrally located nucleus, usually one. We have also intercalated discs or intercellular junctions. Okay. So this is the wall of the left ventricle. Inside, this is the endocardium. So endocardium, myocardium, epicardium. Endocardium is lined by the simple squamous epithelium. Inside the left ventricle, we are looking here is the mitral valve, also called bicuspid valve, also called the left atrioventricular valve. It communicates the left atrium. This is the left atrium. Blood is going through the mitral valve to the left ventricle. It is bicuspid, and we have some cord-like structure. We call it chordae tendinae that connects the cusp of the valve to the papillary muscle. We have two papillary muscle, anterior, and we should have posterior papillary muscle. In the wall of the left ventricle, we have the trabeculae carni. The left ventricle, we have the exit from the left ventricle. Blood is coming out of the left ventricle during ventricular systole through the aortic valve. This is the aortic semilunar valve. Okay, So aortic semilunar valve guard the beginning of the ascending aorta. So that is the left ventricle. Okay. Now if you open the right ventricle, also here right atrium is also open. This is the right ventricle, left ventricle, right ventricle. This is the right atrium. In the right ventricle, we'll find again the trabeculocarne muscles, the tricuspid valve or right atrioventricular valve. These are the Chordae tendinae connecting the cusp of the right atrioventricular valve cusp to the papillary muscle. We have three papillary muscles. We have the anterior papillary muscle, posterior papillary muscle, and septal papillary muscle. The papillary muscles of the right ventricle are smaller than that of the papillary muscle of the left ventricle. Okay. Between the left ventricle and right ventricle, we have the interventricular septum. Interventricular septum is lower 2/3 is muscular, upper 1/3 is membranous, and we may have a gap in the interventricular septum. We call it ventricular septal defect, that is a birth defect. It may be just only one problem, may be a part of phyllostratology, that we may have four problems together. One is ventricular septal defect, another is pulmonary stenosis, right ventricular hypertrophy, dextroposition or right-sided deviation of the aorta. Okay, aorta in that condition get blood from right ventricle and left ventricle. So that is the phyllostratology, that is pulmonary stenosis, ventricular septal defect, hypertrophy of the right ventricle, dextroposition, and overriding of the aorta. Okay, so in some specimen we'll get in some models and also a specimen we should get the moderator band. Moderator band is a trabecule, connects the lower part of the interventricular septum to the base of the anterior papillary muscle. It is called septomarginal trabecule or moderator band that carries a branch of the right branch of the AV bundle to send the impulse to the anterior papillary muscle very quickly. Okay, this is the right ventricle. This is the inflow part. We have also outflow part, and this is called the supraventricular crest. This part. This is the lower part of the Conus Arteriosus, the right ventricle, the conical upper part of the right ventricle from where the pulmonary trunk arises. This part is called Conus Arteriosus. This is called Conus Arteriosus. It develops from the bulbus cordis. Okay, we're getting again inside the heart. This is the right ventricle. The blood is flowing out through the pulmonary semilunar valve. Okay, this is right atrium. Right atrium, this is the posterior aspect of the right atrium. This is very smooth because it develops from the absorption of the sinus venosus. The right atrium receives the superior vena cava, has no valve. Inferior vena cava has a valve during the fetal life or intrauterine life. After birth, it becomes rudimentary, attenuated, and may disappear. This is a part of the interatrial septum, and this is the thumbprint-like impression. We call it the fossa ovalis. Margin of the fossa ovalis is called limbus of fossa ovalis, that represents the septum secundum. This is the opening of the coronary sinus. That is the opening of this vein. Okay, we got the right atrium, posterior aspect, smooth wall. But if you look at the right auricle plus the anterior wall of the right atrium, will get the pectinate muscle or comb teeth-like muscle. So pectinate muscle is present in the right atrium. The trabeculocarne is present in the ventricle. Pectinate muscle is also present in the left atrium on the anterior aspect as well as in the left auricle. Okay, we got that. Now This is the interatrial septum. We may have a gap here along the foramen open. We call it atrial septal defect. But a lot of people has one small pin probe patency, very small patency that may be harmless. Okay, we got that, the right atrium. Okay, now this is the heart, and this heart is so important to us because this is the vital structure for circulation. So what is the circulation? Blood coming out through the superior vena cava, through the inferior vena cava to the right atrium, blood from the right atrium going through the tricuspid valve to the right ventricle. From right ventricle, blood is coming out through the Conus Arteriosus, through the pulmonary semilunar valve to the pulmonary trunk, pulmonary artery, going to the lung. Blood is returning back to the heart through the 4 pulmonary veins. So valve is very important. Valve may be involved in many diseases. So in case of rheumatic heart disease, mitral valve is mostly affected. We may have mitral stenosis, mitral incompetence. In case of drug abuser, the tricuspid valve may be stenosed or maybe some endocarditis change here. Okay, we may have also stenosis, incompetence in the aortic valve here, maybe stenosis, incompetence or regurgitation in the pulmonary valve. Okay, so this is the right atrium here. Okay, the smooth posterior part and the rough anterior part. We have the crista terminalis here. Okay, that junction between the smooth posterior part and rough anterior part. This is the crista terminalis. On the external surface and on the crista terminalis, we may get the sulcus terminalis in our living specimens. Okay, we got that. Now this is the heart. Heart is a structure that is important for our survival. Heart is an internal organ. It should have autonomic nervous system. Okay, so it should be supplied by the autonomic nervous system, sympathetic and parasympathetic. Sympathetic comes from the T1 to T5 segment of the spinal cord. Then it goes through the ventral ramus of the spinal nerve. It goes to the sympathetic chain of ganglion. It goes to the cardiac plexus. We have superficial cardiac plexus, deep cardiac plexus. It also receives, the plexus also receives the parasympathetic from the vagus nerve. So parasympathetic stimulation or vagal stimulation decreases heart rate. Sympathetic stimulation increases heart rate. Heart beat is also regulated by the, or heartbeat is formed by the conducting system of the heart. We have the SA node, the junction of the superior vena cava and the right atrium. We have the AV node that is located in the lower part of the interatrial septum. We have the AV bundle, left and right branch along the interventricular septum, Purkinje fiber in the wall of the ventricle. These are the conducting system of the heart. They are actually modified cardiac muscles. So we got the blood supply, we got the nerve supply. Heart has lymphatic drainage. Lymphatic vessel follow the blood vessels. So the lymphatic drainage to the tracheobronchial lymph node, and it also goes to the brachiocephalic lymph node and also to the mediastinal lymph nodes. So heart as a whole will summarize everything very quickly. This is what? This is the left auricle. This is the LAD, left coronary artery, circumflex artery, left ventricle, apex of the heart. What is the direction of the apex of the heart? In anatomical position, apex is directed downwards, forwards, and to the left. What is the direction of the base of the heart? It is towards posteriorly and to the right. Okay, what structure forms the base of the heart? The left atrium and part of the right atrium. Okay, so the atria and ventricle, how they are separated? By the coronary sulcus. I'm holding the coronary sulcus. Okay, these are atria, these are ventricle. So what are the contents of coronary sulcus? Coronary sulcus contains branches of the coronary artery. It also contains the coronary artery themselves, also the coronary sinus. Remember, coronary sulcus is the junction between the atria and ventricle. Coronary sinus is the vein present posteriorly and inferiorly between the lower part of the left atrium and the upper part of the left ventricle, but it opens into the right atrium. So when you put stethoscope, you will get the heart sounds. How heart sounds are formed? First, heart sounds are formed due to closure of the tricuspid valve and closure of the mitral valve. How second heart sound is formed? By the closure of the pulmonary valve and closure of the aortic valve. Okay, so we also get the word very frequently, the lub dub. Lub at the beginning of the ventricular systole, dub at the end of the ventricular systole. What is systole? Systole means contraction. What is diastole? Means relaxation. Okay, so we got the heart anatomy. Okay, suppose a person has mitral stenosis, surgeon approach in what direction? Usually through the left auricle to correct the mitral stenosis. Heart is a part of the middle mediastinum, so surgeon approach to the heart by giving a longitudinal incision to the sternum. It does not disturb the pleural cavity. Okay, it is a part of the middle mediastinum. What is mediastinum? Mediastinum are the group of structure that is present between the lungs. So this is mediastinum. Not only heart, we have a lot of other structures, but lungs are not mediastinum. So if we take away the lungs, what is remaining in between the lung are the mediastinum. This is mediastinum. We have a lot of structures, and heart is inside a sac. That sac is called pericardium. So heart has a sac that is called pericardium, and that is a closed sac. So that's all about the anatomy of the heart. If you have any question, please feel free to ask me. Please write comments and share the information with your friends. Please subscribe my channel and please hit the button. Have a nice day. Bye now. Thank you.